My name is Dr. Eric Turing. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine, and I want to welcome you to today's webinar. Our webinar today is sponsored by the American College of Veterinary Preventive Medicine, the National Association of Federal Veterinarians, the American Association of Food Safety and Public Health Veterinarians, and the U.S. Animal Health Association. So at this time, I would like to turn this over to Dr. David Fletcher, who is the chair of the ACVPM Continuing Education Committee. Dr. Fletcher.
Thank you, Dr. Torrey. Good afternoon, everyone, and thank you for attending and supporting your monthly continuing education webinar series. I'm very excited to introduce today's speaker, Dr. Mo Salman. He'll be speaking on the role of the veterinary profession in national and global food sustainability. Dr. Salman's a professor of preventive veterinary medicine and infectious diseases at Colorado State University College of Veterinary Medicine. He's a world-renowned leader in veterinary preventive medicine, to include food safety and protection. He has numerous peer-reviewed publications and scientific literature. So we're definitely honored to have Dr. Salman today provide this webinar. Dr. Salman, I'm going to turn it over to you now.
Thank you so much, Dr. Fletcher, and also I thank Dr. Torrings for making this arrangement and keeping this Zoom presentation to go smoothly. It's very impressive. As Dr. Fletcher indicated, is my topic today is I will talk about the role of the veterinary profession in national and global food sustainability. I should be telling the audience, and I'm impressed there are 125 participants. I should tell them that it's mainly I will give some philosophical discussion and presentation. So it's nothing like to show like any type of, I will call like a clinical application at this time, but maybe is we are looking on this issue from the 33,000 feet high approach now. First thing I want to indicate is what the definition of some of the terms I will use, because they are different definition or different concept about them. So I took this definition for food security from the World Food Summit that was conducted in 1996, way back, and it was coordinated and organized by United Nations. And the definition say, well, all people and have physical and economic access to sufficient, safe, and nutritious food that meet their dietary needs and food preference for an active and healthy life. I highlighted a couple of these terms because it will show like is not only like availability of the food, but also how the physical and economic access to it, but in addition to maintain a healthy and an active life in that respect. When I looked on especially with the internet, on the best definition I could find recently for food sustainability, Arizona State University had at least in my opinion, the best definition that being very comprehensive about what we mean by sustainability. And it's mainly to mean is the producing food in a way that protect the environment. And here is very important. They start with the environment and make efficient use of the existing and natural resources, but also ensure the producer and the farmer that can support themselves. So it's not only like donation in some way, and enhance the quality of the life of the community that produce food, and including the animal as well as the people. You could see is a very comprehensive about what it means in that respect. I want to start by saying this is nothing in you. Dr. Karen Habas who is a member of our college, and myself. In 2010, we worked on this issue mainly to come with the component and the challenge in the food security at that time. And it was not so much appealing mainly to the science and also to the audience in general, mainly because we associated at that time food security with only the defense and the war or whatever. But I thought like it shows like we tried to address that issue before now with the interest and getting in that way. I want to get your attention about this statement about in the abstract about food wholesomeness is also an important aspect of nutrition. Wholesomeness is monitored via food safety and food defense programs. This is, I really would like to say, is very important, especially when we talk about the comprehensiveness of the issue in that respect. An alarm came on by the what is called the Global Food Security Index, in which they collected data and statistics on a regular basis. And the alarm came in 2022, in terms to say there is a decline in the global food environment, and was really like a trend coming after 3 years in a row in that respect. I look at that is a good beginning to see and dissect what it means by the food security index and how that it can be addressed in general for both United States, but also on a global issue in that respect. The index that's being developed by this organization is mainly to explore challenges. So it's mainly to identify gaps and to develop some solution that can be good for the food security. And it was done in this index among 113 countries. The index is usually or was used very comprehensive quantitative scoring system for using 4 topics, which I will elaborate in a few minutes from now. I want to emphasize, like, again, having this among the 113 countries, it will be an easy way to compare and contrast because we are using the same systematic way to address that issue. From these index, they mapped the world in such way with a different type of like a scoring system that it goes all the way from 100, which is mean very sufficient, secure food, all the way to the very poor, and that could lead to the like a disaster as happened in some of the African countries. I encourage the audience, if you want to maybe look on a specific country or to look at it globally, to consider this website and try to go through it and see what it lead to it. One thing I borrowed from this is this scoring system is the list of these countries and how they are ranked. Okay, you could see like it started with the Finland as the overall score is the one of the best, okay, and all the way to the last countries, it is number 113. I just cut it to number 20th because mainly to focus on these things. From this table, you could see like is what is really being addressed here is the 4 topics under these topics, which I will elaborate, and the role of veterinary medicine in each of them. But I want you to get attention to United States here. You could see United States, even though it's considered like one of the top, let's say 20 countries in terms of the secure food, it still is lacking to be one of the top, 5 countries in that respect. And mainly when you look at this type of scoring system, you could see like is the main reason for low, relatively speaking, low score is the availability, but also the sustainability and adaptability, whereas really like United States scored low as compared to the other countries. I think also we should be, especially in from the profession of veterinary medicine, we should be proud to see like how the quality and the safety of the food and the scoring for that is high, and mainly because of the hard work and the implication of a very good standard in terms of the food safety that we can follow in the United States, mainly or I should say both in terms of the industry, but also in the policy and the government, how they go through the application in that respect. I thought like, well, I will give a little bit idea where among those with the low food security or very low food security in both, like low or very low, is where is the issue and what's the most important factors can lead. This organization did a survey and they come up with this type of like factors or ideas where is the issue will be related. I should get you pay attention to that worried for food would run out, even like still can be addressed in among countries in which like the food secure is scored very high. It still is considered among some of these people like the food is not enough for them in that respect. But you could see also like where the issue like that can be maybe addressed in terms of moving countries from being very low or low into a little bit better in that respect, and by addressing some issues related to both production but also policy in that respect. What I'm planning to do for the next few minutes, I will address these 4 topics that will be like being assessed by the GFSI, and to go through each of them by giving the definition for what they consider, and then to give some ideas about like where the role of veterinary medicine can be in that respect. I believe like by doing that, I will give some ideas about, in my opinion, or where we can contribute to these, I would call it very important topics for food security. So under the definition of the affordability is mainly the ability of the consumer to purchase food and their variability to the price, their flexibility to the price and the price shock, and the presence of the program and policies to support consumer when shock is occurring. Giving that is, if you recall, is like our score for the United States was not very high as compared to other countries. So what I feel like is where the role of the veterinary medicine will come is in the engaging in the production system. And that is being done for long term, in my opinion, since 1960s, in which like veterinarians contributed through the both herd health, but also through production system, engaging in with the animal scientists in building a more efficient production system that is considered good in nutrition to the animals, but also with the welfares, but also to have efficient production in that respect. I really believe like United States, and especially the profession of veterinary medicine, has contributed a lot to that idea. I will give an example about how the affordability had, I would say, limited during the beginning of, which is still going, of the high pathogen avian influenza, and how the egg prices get so high that it was not affordable by even some of the middle class families in that respect. I look at it from the aspect is it was a good way to get the decision makers, but also to the community in general, to pay attention to the importance of the animal health issues and diseases in terms of giving them or affordable food, particularly in United States. The second topic is by GFSI is the availability. And availability, the way they define it is to measure agriculture production on farm capability and the risk of supply and any disruption on national capacity to dissemination of the food and research to expand agriculture output. How that could be the role of veterinary medicine is, as I said before about the affordability, production system in the United States is very efficient, and the feeding program, including herd health activities, are very important to improve the type of availability in that respect. I will never forget when I was in California in the late 70s and early 80s, how dairy farmers moved from using mixing any type of products for feeding the dairy cows to moving to what they call the bulk, and having almost is a storage area, and depends on the availability of any of the ingredients, and especially the price, and how that is improve the production for the milk in that respect. But in the same time, the challenge to veterinarians at that time is to maintain the healthy animals and not to miss any type of nutritional balances for giving a better milk, but also the health and the welfare of the animals. I would like to give the example about what happened in the disruptions in the food chain supply through animal and human health status during the COVID-19, and especially in the swine production in that respect. I hope all of us, because still is fresh in our mind, remembered how both the well-being of the animals, but also the price of the pork is in both of them suffered because of some of the labors, and especially in slaughter plants were suffered from the COVID-19 and did not allow the continuation of the food chain supply in that respect. The third topic is the quality and the safety of the food. And the definition they put is how it's measured in the variety and the nutrition quality of the average diet, as well as the safety of the food. In my opinion, I will not put as well as the safety of the food. I will put through the safety of the food, because if the food is not safe, then the nutritional value and the average diet will suffer from that. So it's that I think is a very obvious, the food safety is very important. I don't have to go in a lot of the elaboration about the food safety programs and the contribution of veterinary medicine to that. I think it's very obvious, is we continue supporting the food safety, and especially for animal origin foods in that respect. And I will mention later about when my recommendation, what the limitation of the current status of our food safety in the United States. I wish, like the rest of the world, will follow the same rule as we can do here in that respect, or what we have done, I should say, in that respect. And the quality assurance of the consumer, especially for the animal origin food, and the application of the HACCP measures is a good example about what the role of veterinary medicine in that respect. In my opinion, HACCP is the scientifically based, that it can take into consideration both the issues related to any type of the health problems, including the safety of the animals, and also to come with certain measures in that way. I believe, is in addition to Europe, United States is also leading countries in terms of the using of the HACCP, and not only in a documents on a written, but also in action in that respect. And the fourth item is, or the fourth topic is sustainability and adoption. I will elaborate more on that next slide, but I want to give what the GFSI give the definition for that. It's mainly the assess the country here, the exposure to the certain impact, or let's call it negative impact, of whether climate changes and its sustainability or its stability to natural resources risk, and how the country is adapting to these risks. I feel like that's very important. And the role of veterinary medicine, in my opinion, is engagement in environmental health and the occupational health activities, utilizing, in my opinion, the uniqueness in veterinary medicine and the profession of veterinary medicine, utilizing the comparative medicine. This is, I really like to say, is unique in veterinary medicine, and that's where I think we need to focus and emphasize and encourage in that way, in use in that respect. And the example I have about the sustainability and adoption is the disposal of carcasses during highly contagious animal diseases, and also measuring the climate changes and impact on wildlife population, but also even on domestic animals, including companion animals in that respect. I think here I want to say is what I see as is the bridge of veterinarians between the agriculture discipline and agriculture sectors, and also the medicine profession and the human health and environmental health in that respect. Now, let me move a little bit about that issue with really related to the food sustainability. What I will try to do is here give the components or the dimension and the associated factors linked to the food sustainability, and then to give a little bit about the role of the profession of veterinary medicine, and then to come with recommendations or action plan that I feel like is important. As an epidemiologist, everything we see, as we said in a definition, either into a three dimension, what we call the Triad, okay, or we see it in a 2x2 table. This is, in my opinion, wherever we do this. So here I will use the Triad, okay, the three dimensions for the food sustainability. Again, this is only my opinion in that respect. The three trials is the social and the economics and the environmental dimensions of the food sustainability, as it was defined in the previous slides. However, is the most important part is the intersection between these three dimensions. So you cannot address one without considering the impact on the other dimension in that respect. So what we mean here, I'm just giving an example about what's the meaning of these three components for the food sustainability. So the social component is mainly related to the culture, historical diet tradition, human resources, etc. Okay, that's really like very obvious what I mean for a lot of us and listening to this. The political issue and the financial support, I put it under the economics and including the government policy, which is again a major dimension or major component that contribute to the food sustainability, both in good and bad. In terms of the environment, is very obvious, the climate changes, geographic location of the production, and also the animal and plant diseases. Unfortunately, what we focus when we talk about like we as veterinarians and how much we contribute to the food sustainability, we said, well, only in the animal diseases. I don't really think that's the accurate way of defining our role in that respect, because our role is involved in all of these aspects in general. But also this type of triad should be not only related to the final products, okay? It should be related all the way in the entire agriculture production and processing and retailing and to the consumption. I really like to call it, especially when we come for food and animal origin foods, I like to call it from the conception to the consumption. Sometimes in Europe, they call it from farm to the fork. I think is even within the farm, we need to be more involved in even all the way to the reproductive performance of the animal in that respect. Another thing is let's call it like a think tank group is the Global Alliance for the Future of the Food. They have 7 principles of the food sustainability, and they put the 7 principles into the following like items. You could read it all the way from renewability, resilience and health, and the equity and the diversity and inclusion, and then the interconnectedness. I like to pay attention for the interconnectedness. That's what I mean by the intersection. I don't think you could look on any of these principles, which I think is very valid, without consider the other part in that way. Our pandemic with the COVID-19 showed like how all of these are related, not only to the human health or animal health, but also related to the food sustainability as a component, in my opinion, of, I like to call it, the community well-being, whatever community we want to do with. The next 2 slides, I'm planning to say, well, so what? Or where we go from here? So I put my thought, what I will call it like, not only my thought, I will share with you the contribution from 2 wonderful people, is Dean Ellen Kelly from University of Pennsylvania, former dean, and he passed away last month, unfortunately, and Dean Benny Osborne, former dean of the University of California in Davis. I should give them the credit is what I'm presenting as far as moving forward, because they challenged me and I also shared with them what I think in that respect, in that way. moving forward, we need to really work with the One Health concept. And that should be and I like to call it a golden opportunity to give the policymaker and the public our idea about what are we trying to do, and to promote the concept through a specific effective action. These days, I am very hesitant to use that term One Health concept, because it's being abused in so many areas, and really like by people, either they don't know what it's meaning of it, or by taking it into very narrow silo as far as what they would like to consider. But I would like to say is the profession of veterinary medicine has been the leading profession in a promotion of One Health concept. And we need to continue that, okay, but we need to come with the specific effective action in that way. The profession of veterinary medicine must take immediate action to utilize available resources and approaches to measure One Health, okay, or measure under One Health concept. That will require more aggressive way of coming with indicators, coming with some ideas about like how we can apply that on a community basis, and how we measure it in such way, and how we convince other related professions and discipline, like we can be the leader in that respect of the under One Health concept. That will also, we need to maintain reliable and sustainable food and health condition for low and median income countries. I know we are talking about United States here, but we cannot ignore the other countries, that because either economic aspect, because we are the suppliers in so many ways for food for them, and also the economic well-being, but also to need their political, I would say, a blessing for our policy to move forward in that respect. So that will require much more involvement on a global issue about the food and health conditions. And I would like to say is, even though like we think like we have all the techniques and technology that we can deal with food sustainability so far, it still, I think, is there are some approaches that we can explore and we can find by just looking on other nations and what they are doing in that respect. All the time we can learn from the others. All of the above, in my opinion, require coordination and leadership. I will emphasize on the leadership. A leadership should have the vision and consistent funding resources. In my opinion, if without vision, the funding resources will disappear, and with a good vision and a plan of action, I believe like funding resources will be available in that way. I would say like is we need to identify and find this type of leadership among our profession as much as we can do. I also believe like ACBPM and its membership will be a great place to start and to find this type of leadership that they can have the vision and move the profession forward in that respect. And I really think is the profession of veterinary medicine can lead the efforts in utilizing One Health concept in solving issue and maintaining food sustainability that as good as possible for the United States, but also for other countries. And that will require dedicated available national and international resources. for food security. I also think is we need to build on, because of this, we need to build on our success and our effective measures that we have taken so far in maintaining food sustainability, both nationally and internationally. I think the current crisis with African swine fever is a good example how a preparedness is a very good way to move forward in keeping the virus away from the border, even though it has some uncertainty. I also would like to say is both the national and the global effort to almost eliminating the crisis with bovine spongiform encephalopathy, the BSE, I think that should be addressed in such way as to celebrate the success in that way. Fortunately, 2 weeks ago, the OHA, which is formerly OIE, had a very good news segment about the success with the BSE. But I also want to say is because the disease stopped from being a disaster, global disaster, and including also national disaster in the United States, because of that is really we don't pay attention to it as compared to other diseases in which it was a disaster, like whether it's the plague or even the COVID-19. I would like to say is some of the effort that been addressed during the COVID-19 in some countries, such as UK, which is now going through the question and answer, assessing what's going on. That effort were really linked to their success in controlling BSE and foot and mouth disease in the country way back by the veterinary profession. We need to emphasize on that and move forward with that type of success, and not only to focus only on the negative side. The negative side is mainly, I like to call it, lesson we learned, and then we can move forward with that. And that will, as I said, will require promotion of food sustainability and health and well-being of the community at large. I think we should move away from the only we are interested in the animal health and to move to say, well, we have the interest in the health of the community, in including animals, in including the environment, and including the human part of that equation. Well, saying that and being in the education for the more than 40 years now, I like to say is here is also I put some of the recommendations what I feel like is needed to be done in veterinary education. The way I see the veterinary education is the first step to both promote the profession, but also to move the profession in the right direction if we believe in that. So the first thing I think is our curricula should be sufficiently broad and flexible to adjust for the change condition and accommodation relevance to the discipline and the available tools for the information. We should move away from what we presented, and including myself, how well describing diseases in the way like in a textbook. I'm not saying that's wrong, but the students are very aware where they can find this information if they have the interest. We should move away from being like teachers to be facilitators. We should move away from being like teachers to be more on challenge the students in terms of the analytical tools that they could utilize in both the diagnosis of disease, but also to come with the right solutions in both prevention and treatment. And that will, my opinion, will require NAVO to emphasize on the population health and all population medicine, but also the global health. And I really feel like that will serve both what we are now call it companion animals medicine, but also the other animals that we can serve. Is not like I'm with the focus on only like the food producing animals. If you look on the current practice in the United States and what I like to call the mall clinics, shopping mall clinics now, is what's the main business that it's attractive is the preventive part, because what they do is they try to bring the clients as much as possible to come to the clinics at least once a year. And in that way, they can sell products, etc. Currently, we should try to focus on that type of approach in which like the prevention is worthwhile rather than only the treatment. Okay, so that I think is my message today about that. And extend the profession of veterinary medicine to accommodate the training of animal health technician and paravets. These are now, actually today, there is some news from AVMA that still we have shortage in the animal health technicians. Is not to compete with us, is not like it will threaten our job security. They are part of our, like, let's call it forces that can apply services under our directions. Let's look on the model, what happened with the dentist and the dental hygienist. Let's look on the model of the physicians and the use of the nurses and nurse practitioners in that way. That did not eliminate the physicians or the dentists. So let's think that way, which will require more of our involvement in the training and education of this type of people. But also, I think is, since I mentioned about like our engagement with low and middle income countries, we need to think about like taking the lead by establishing 3 or 4 global centers of excellence, particularly in developing countries, to disseminate the new type of education on veterinary medicine, and also to produce something that it can be under the One Health practitioners instead of focusing only on selling. Currently, majority of the countries, the private practitioners are making money from selling food for the dogs and cats. However, that doesn't eliminate the to have an income for them, but is need to be more than that in that respect. And also because of now, and including this virtual education session, we should learn and use that virtual education as a way to disseminate the education and the information in that way. And I would like also to say is we should try to now from the other side educate and build awareness among our professors and the staff members in our colleges in the United States. It's becoming less and less to be more broad and more focused. I was how should I say it? I mean, I was astonished by having, I asked 2 anatomical pathologists, very good anatomical pathologists. We used to call them a gross pathologist. That's not the right term now. And they are very good in maintaining necropsy. I asked both of them independently, have you been in slaughter plants? And the answer was negative. And the reason I thought like at least for them to see what a veterinary meat inspector is doing there, because part of the inspection is examination, is diagnosis, okay? And it's almost like a specific method for the necropsy. And in my opinion is they can learn from the being there, but also the meat inspectors in some way they can learn from the pathologist. For that, and I really would like to say is I have heard a lot about the current reduction in the veterinary forces in the USDA FSIS. And there is a lot of discussion about like how that could lead to a great, and I agree, a great suffering to our meat inspection in general. But I also don't look at it as like a way to try to promote it because of the job security. I think we should try to promote it by building the awareness among the decision makers of the importance and the essential role of veterinarians in the diagnosis of a food safety issue, not only on the animal they examine, but in general. And that will really lead to maybe like to focus on what is used to be called post-harvest versus pre-harvest. I think it should be a continuum chain, and they should be addressed in that respect. And in that way, and there is a need for this veterinarians to do the comparative medicine and comparative pathology in that respect. And with that one, I end up the talks, and I think I still have like 11 minutes for question and answer if there are some.
You do have a couple minutes left, and you're right, 11 would get us to the hour. We do have several questions, and I will just start off with the first question that came in. First of all, kudos. It was a great presentation, or it is a great presentation. The question is regarding sustainability and adaptability. What changes do you think production agriculture could or should consider implementing in the U.S.?
That's a very good and valid question. If you will ask me, I think the most important challenge now for the industry is to reduce any type of crisis, and specifically related to morbidity and mortality. And that's where I really believe the emphasis on biosecurity among the intensive livestock companies and premises is very valid. And that's number one. The number two, and I feel like, is the climate changes. And this is, when I said climate changes, is not only the human like interference. I also think maybe is a cycle, okay, we are going through. The climate changes now will really is interfering with the production cycle. And this interference with the production cycle, fortunately, the industry, and particularly in the United States, have already adapted and try to really consider that as much as possible. And that's not because of science, be honest with you. I think because of the economic aspect. Still, science is needed, and the science should react to the economic aspect and try to accept the modification, but also identify the limitations in those.
Excellent. Second question is whether you have any thoughts that you can share on fish or farmed aquaculture in terms of sustainability and environmental impact?
On which farm? I'm sorry.
Fish or farmed aquaculture.
Yes, yeah. Well, it's especially like now in China and Southeast Asia, and they are more advanced than us in that respect. But they are also, I like to say, a major contributor to interference with the climates. And I'm talking about farms, like with the aquaculture. But let's face it, fish is a very good protein source. And if we can produce it, similar what we had done with the poultry, in a very efficient way, okay, then I think that's a good solution for feeding hungry children in Africa or in Asia in that respect. So I'm not against it in that way, but I also needs to consider like how much an impact on the environment that it can lead to. The European Food Safety Agency has produced a very good report about a practice of the aquaculture and the impact, and both the negative and the positive side in that way. I really like that, but it's also, I think there is a huge pressure from the, let's say, the public to allow more of the seafood and fish to be available in the market in that respect. And I would like to say here something is like this, how I noticed like in Central Asia, and especially in the production of shrimps. I visited one of the largest shrimp company in Indonesia, and the way they are, and they mainly their main like exporter to is Europe. And Europe will require a very aggressive and rigorous antibiotics testing of the shrimps. So what that farm was doing is they don't discard when there is any positive for the antibiotics use in a fish, in shrimp products. What they do is they put it on a side, and that the one is what's sent to United States, because United States did not ask for it. This was like maybe 5 or 6 years ago when I saw that. And I'm not saying we should follow the Europeans, but we should complement each other in terms of both in policy, but also the health issue in that respect. So shrimp farmers in that area, they don't really like being punished by abuse of the antibiotics, because they know if they don't sell it to Europe, they sell it to United States, even though it's cheaper than Europe, but still they can sell it in that respect.
This question is regarding funding. You mentioned funding in your presentation. Do you see funding being a centralized government responsibility or something that can or should be shared with private industry?
Again, I like this question. I think it should be shared. And unfortunately, the private sector is very competitive, and especially when you talk about poultry or aquaculture. And because of this competitiveness, they really don't want to share any type of funding without knowing how much they can make on this type of investment. What I really like to say here is maybe what is needed is the model used in Denmark for the swine production, or swine industry, in which they are putting some money similar to our check program here, and also the government put some money, and the academic environment also put that money, and any type of decision is taken by an almost independent advisory group that representing the three components of that aspect. This is, in my opinion, is not being addressed here in the United States, because the industry here, and to give them credit, especially like in the poultry or the pork or the swine, they are doing a lot of good research and good funding. Don't take me wrong, but they are working almost independently from the government to a certain extent. And the government is also putting some money, but is almost independent from that. But I think we need to move away from that, but also not to ask for funding for animal health. Let's move from that aspect and call it food. And food is very important for everybody. So that, I think, is what we need to focus on. And the animal health is part of the production, instead of the production to be dictated by the animal health.
A couple more if you have the time.
Sure, I don't want to keep people after the hour, but I have time. Yes.
I think the topic is very interesting, and I'm watching the attendance, and folks are captivated by the material. So you mentioned a potential decrease in FSIS veterinarians. Was that in reference to the proposed DVMO role within FSIS?
Correct. And I will be the first one to admit it. I am not so much familiar, but talking with former and current FSIS, I was informed that they are expecting less involvement of veterinarians. And to be fair with FSIS, they can say like, oh, it's very hard to find veterinarians now to work for us. And I'm in agreement in that way. So it's not only to blame it on the agency, but also to blame it on our profession, because we have not, and especially in academia, we have not tried to promote meat inspection as part of our profession. And meat inspection, it should be like through pathology, not only to say, well, here are the rules and you need to follow. The rules will come after you have scientific evidence for it.
I'm going to ask this next one, and I know we could probably spend an hour in itself on this question. The veterinary community has been at the forefront of championing One Health for some time now. But what else can we do to get buy-in from public health and human medical communities?
Well, as you said, Eric, that we can spend an hour, but my short answer here is we are shouting among ourselves. I'm sorry to say that. We need to show with evidence, okay? And the evidence will come by sometimes we sit in the back seat and let somebody to drive us. And the driver will recognize how important are we in the given direction of the path or the way we should go. Let them figure out that. When you talk with physicians in general, they will say, what's the big deal? Okay, we practice One Health all the time. And when you talk with the environmental people, they said, well, you really focus on animals, leave us alone, because you don't know about the air quality, you don't know about the water quality, and etc. And that's where I think we need to change. Demonstration with active involvement. during the COVID-19, when somebody suggested to go and test waste water as an indicator for the presence of the virus in a specific community, to my knowledge, none of the veterinarians will say, by the way, we have used that and we know the limitations, okay? Let us help you to implement such way to screen for the virus. When they said, like, we do trace for the cases, we didn't really contribute both nationally and globally to say, well, we've been using a trace back and we eradicated diseases in animals using the system. We know how to address that issue, and we know the good and the limitation of this approach. We didn't do that.
Okay. And I think there's one final question, and I think it's somewhat linked, similar answer that to your last question, or to the last question. You know, how do we address the increasing salary gap between, veterinary clinical medicine and, global health, population health careers?
Well, I usually say, well, I hire a plumber or electrician here, and I figure out they make more money than I do, okay? And I know money is important, don't take me wrong, but I really also think is like building more professional respect among the community. That will help, and in the future, that will lead to a better income for us, whatever we are doing in that direction.
I'm going to turn it back over to Dr. Fletcher. I want to thank Dr. Solomon, did a fantastic job. And Dr. Fletcher, do you have any final comments?
Yeah, I also want to thank you, Dr. Salmon. We truly appreciate your willingness to be a part of this webinar program. Your knowledge is and experience is outstanding, and we're just happy to be a recipient of that. And again, I thank everyone for attending today. If anyone has a specific topic or would like to refer a speaker for the webinar program, please contact myself or Dr. Doring. Your opinions and suggestions are important for the continued success of this program, and we appreciate any recommendations and suggestions that you have. And that's pretty much all I have, Dr. Doring.
Thank you, Dr. Fletcher, and appreciate the plug for the program. So once again, thank you, Dr. Solomon. A great presentation as always. And any final comments from you?
Well, I really appreciate the opportunity to share my thoughts, and I don't want to apologize, but I also want to say is these are my thoughts and not really to reflect anything like coming from the Colorado State University or other people. I think the respect to the academic environment should continue, and I am willing to whoever would like to have any type of questions. You have my email address, and I am addicted to email, so whatever I could do to help you and to answer anything, I will share with you that. And I will maintain my positive attitude about our profession. I think the future will be bright.
Well, thank you very much once again, Dr. Solomon, and everybody. Appreciate your attendance, and have a great evening, afternoon, wherever you may be in this world.